Hi everybody, it's Marjorie Klein coming to you from our office. I'm the licensed clinical social worker, just the talking counselor here, and doing a few vignettes for you all. So today, another one of my ideas was to present something on good self-care, which involves maybe using relaxation techniques to cope with anxiety, or also it also helps with cravings, and talk a little bit about sleep hygiene. One of the things we know about people that have irregular sleep patterns, they secrete a hormone called ghrelin that really increases a person's appetite. So if you have poor sleep habits, your body's working against you. If you have good sleep pattern, you secrete a hormone that tells you that you're satisfied. It's called leptin. So sleep is something that sometimes we work with patients on how to improve their sleep hygiene. So that's what we're doing today. So first of all, with relaxation, you will get a handout attached to this so that you can look at that in more detail. I like this particular idea because it's called Relaxation Breathing 478. The idea is, okay, what you do is you're in a relaxed place. If you can, I do it in my car in traffic, so it works that as well. You breathe in through your nose for a count of 4. You hold that breath for a count of 7. And then you slowly breathe out to a count of 8. Now the handout does talk about holding their tongue to the top of your roof and breathing through the outside of your tongue. And I find that kind of awkward myself. That probably is some kind of yoga thing. But what I was taught was just breathe slowly like you're going through a straw. So you do that for a rotation of 4. So it's in for a count of 4, hold it for a count of 7, and then for a count of 8. You do that in a rotation of 4. Now the reason this works for anxiety is because it slows your heart down. You cannot do this without physically having your heart slow down, and one of the things we know when people are anxious and starting into panic, their heart is going very rapid. The other thing is it works really good for cravings because it does distract you. It feels good, you're doing something. So I think this relaxation breathing is a very, very good technique, and you do it as often. Do it a rotation of 4 as often as you need to. You do it for the first 4, kind of see how you're feeling. If you need to do it again for another rotation of 4, go ahead and do it again. But I think that it's a very simple technique. If you're sitting in a room full of people and you're feeling anxious, you do this. Nobody knows that you're doing it, but it's a really good way to kind of calm yourself and center yourself if you're feeling anxious. But don't forget to use it if you're having cravings as well. The other thing about sleep hygiene, and it's very simple things, but you just want to make sure you have some kind of consistent schedule. I admit, scheduling in these times, the COVID-19, having a schedule has been very difficult. The other ideas are things like not going to bed until you're sleepy. And if you don't fall asleep in 20 minutes, just don't lay there and toss and turn and get frustrated. Get up. There is using some relaxation techniques before bedtime routinely, and one of the best things, and you can look online and find this, is called progressive muscle relaxation, where you're taking each point of your body, tensing it for maybe a count of 10, and then relaxing it and moving maybe from your toes all the way up to your body, to your face. Doing that, I think, can help with sleep hygiene, and you can find that online. Progressive muscle relaxation, it's what it's called, or even just listening to music. I like listening to music and doing the muscle relaxation. Make sure you turn your devices off 30 minutes before bedtime. Movement, we know, helps, and I know when I do things out in the yard, and sleeping's a whole lot easier for me. Of course, we know about avoiding caffeine and alcohol before bedtime, and just not eating too late, drinking too late. Those are simple things, but just want to encourage, if you can, to do what you can to have a regular sleep patterns. Again, it's all in that theme of good self-care, and also some relaxation techniques to help if you have anxiety or coping with cravings. Thank you.